So welcome to your massage today.
Thank you.
And I heard that you were having a headache.
Mm-hmm.
Can you tell me more about it?
It starts from my shoulders up to my neck,
Mm-hmm.
and then all around my head and my forehead.
Okay. So you're feeling it all around your head, so the sides, the vertex, up here as well?
Mm-hmm.
What about over here in your temples?
My temples too.
And here?
Mm-hmm.
So just everywhere.
Yes.
Okay. So we can definitely do some acupressure points that are directed to just sort of overall helping to improve your headache.
Mm-hmm.
And we'll also do a neck massage and a shoulder massage, okay?
Okay.
To help relieve some strain. So I want to start by just checking your scalp. Just going to release this. And how often do you have these headaches?
I would say once a week.
Okay. I'm just gonna keep this. Put that right there. And is it usually around the same? Like, do you know what starts it?
Usually I get it in the morning, so I assume it's the way I sleep at night.
Mm-hmm. So how do you sleep at night? Do you just kind of like your neck at a weird angle?
I like to put my neck
Like that?
Yes.
Okay, so that puts a lot of strain
on.
on this side especially. Okay. Is it usually on that side? Like that?
Yeah.
Okay, that's good to know. So I'm just going to use these two needles to kind of, they're actually knitting needles, but I find they're really helpful for assisting me in checking the scalp. So the reason why I do this every time is because it's really important that I make sure there's no trauma to the head anywhere, because this can be contraindicated for the scalp massage. And if you have any rashes, any irritation, I definitely want to know before I put any oils on it. So just looking closely, and so far looks quite healthy. Okay. Kind of detangling as I go as well. Have you had any itchiness in your scalp? Any dryness? Anything like that?
No.
That's good. Feel free to just relax, I know you're probably feeling uncomfortable because of the headache, and I'll definitely help you with relieving some of that pain in just a second as well. I just want to make sure that I'm not missing any spots, abrasions, any signs of, eczema or seborrheic dermatitis, anything like that. Okay. And over on this side, just making sure that I don't miss anything here as well. Okay. Come over here. Okay, looks good. Just check over here as well. Do you have any allergies at all to any skin products or foods? That's good. Because I do want to use a little bit of Peppermint Halo. This one's Peppermint Halo. And the Peppermint Halo has mostly peppermint, eucalyptus, cajeput, rosemary, lavender, and vetiver. And you'll find that it has a really nice, tingly, cooling sensation. Have you used it before?
I have.
Do you like it? It sort of has an analgesic effect. So I'm just going to come back here on your neck area as well and apply some. I should just tie up all this hair again. Just gonna get it out of the way while we work on this scalp massage. Or the neck massage first. There you go. Is that okay? It's not too much tension or anything like that. Okay. So I'm just applying some Peppermint Halo over here as well. And on the other side. Very good. Down on your shoulders. And then I'm going to use some massage oil. Just kind of massage that right into the neck and shoulders. Are you feeling the cool, tingly sensation yet?
It's starting.
It usually starts in a few minutes or so. Okay. Just gonna move this down slightly. And just starting with scooping the neck muscles. So we have the SCM here in the front, right? And the traps right in the back. So these are the two main muscles that really get strained. And the traps go all the way down here to the acromioclavicular joint. Just scooping that muscle in. I do feel a lot of tightness, especially on the left side. It's good to take some deep breaths, especially with the peppermint. It helps with opening up the respiratory tract as well. I actually kind of feel it getting into my eyes also. Good. And I'm just going to I want you to relax right onto this hand there. And I'm going to just do some finger kneading from the bottom of the trap. And right here I feel a nice knot, and I'm actually going to use my knuckles and kind of work on that. Good. Just relax. Very good. Okay. Working all the way up towards the ears. Then on the other side, same thing. Working on that. And right there again, that trap muscle is just really, really tight. Working on loosening that, getting more blood flow here. And I think I'm actually going to do some Gua Sha as well, which is an ancient Chinese medicine practice where you sort of bring a lot more blood flow, break down muscle adhesions, and you might have a little bruising by the end of this also, but it's perfectly normal. It actually helps to allow the muscle to regenerate itself. Do a little bit of traction, okay? Very good. Also feeling along either side of your cervical vertebrae, feeling these paravertebral muscles underneath the traps. And there's a bit of tightness there too, so I'm just going to use my thumbs and sort of just knead through there. Good. Just want you to stretch ahead all the way as far as you can go. Good. Just lengthening that spine. Very good. I should come back as far as you can go. Over here on the left. Very good. Right. Perfect. You can do these neck stretches every day as well. How's your headache feeling right now? Better? That's good. Okay. So now I'm going to be doing some Gua Sha. And I'm actually using a spoon this time. It's just a porcelain spoon like this. Okay? And I just want you to tilt your neck just like that. Perfect. And we're going to go pretty soft. Since it's our first session, and I'm just working down like that along the muscle. And when you're doing Gua Sha, basically some of the capillaries end up breaking, and so you see the bruise that forms, kind of like cupping actually. So you just work your way down the length of the muscle. And I'm already seeing a little bit of bruising. This is a good sign. You definitely don't want to do this before, a photo shoot or anything like that. An important event. we'll give that side a bit of time to rest, and we'll work on this side over here. How are you feeling so far? Okay. Just gonna move the shirt a little bit. And again, just working down that SCM, working down the trap. I'm using force when I'm coming down. Softly when I go up. And I really want to put more pressure right here. You know where I feel that knot? When doing Gua Sha around the neck area, you have to be really vigilant about where you're actually working. The back area is pretty good because you don't have a lot of blood vessels there, at least not at the surface. But the front area, you have to be really, really careful because that's where, you know, your jugular veins are, and carotid artery, vagus nerve, like all of that is right there, right? Okay, coming back to this side and just putting a little bit more pressure. Yeah, just relax like that. Let me know if there's any pain, you know, anything like that, because we don't want that. Gua Sha really shouldn't be painful at all. If anything, it should feel good. Just relax again. Definitely seeing a lot more bruising now. But it won't last long by any means. Just maybe 4 or 5 days. You don't really have anywhere to go, right? Perfect. I definitely feel that it's loosened already quite a bit. Okay. Other side. Yeah. All the way down the length of the muscle, all the way from its origin to its insertion. Perfect. I still feel that knot there, but luckily that's the exact area that I'm going to be doing some acupressure. In our favor. Good. How does that feel? Since we're at the neck, I'm going to start with your first 2 acupressure points. So gallbladder 21, you'll find it pretty easily. You just work along the trap and you find the highest point, which is actually right where your knot is. So right here. So I'm going to find it on both sides and work on them together. So right there as well. And you just press into it. We're going to do circles one way, and then we'll switch back the other way. Very good. And this point is not only good for shoulder pain, but also neck pain, neck rigidity. Helps to descend chi and remove obstructions. Because in traditional Chinese medicine, we say that a lot of pain is caused by obstruction of the flow of qi or cold conditions or stagnation of blood. These can all cause pain. So for example, in liver qi stagnation, we have stagnation of the liver's qi, and that can cause menstrual cramping. So in this case, with this point, it really helps to, get the qi flowing through your body better. It also helps with headaches, interestingly. Perfect. We do the same point, but we're going to move. So we were doing this. We're going to go in the opposite direction with my thumbs. You can do this about 10 times. Very good. So that was gallbladder 21. Now we're moving to gallbladder 20. And this is actually right in between the depression, right in between the sternocleidomastoid muscle and the trapezius. So you'll actually find it right here. So I'm just going to find it on both sides. Find that nice depression right lateral to the trapezius muscle and just working there. I'm actually going to do this one at a time just because it's a little difficult doing them both at the same time. Just going to good. Perfect. This point is excellent for occiput headaches, neck stiffness, neck rigidity. Very good. Okay. Now I'm going to let down your hair. I'm just going to do a scalp massage. Actually, just going to need a little bit of oil. By the way, are you having any cold or cough symptoms? No? Okay. I'm asking that because oftentimes headaches can be caused by viral syndromes. And so if that's the case, then we really have to make sure we're treating the root cause, but also making sure you're getting adequate rest. And I also have a remedy that can help with that, but we don't need that right now. And are you drinking enough fluids these days?
Yes, I
8 glasses of water?
am.
Great job. Do you find that that's helping with the headaches?
Definitely has.
Good. So I'm just working that oil right into her scalp. Just warming up the scalp for nice massage. This way I'm just improving circulation to the scalp, which can be really beneficial before doing acupressure or acupuncture. It also helps with hair growth, so that's a nice benefit. And with you, we definitely want to make sure that your scalp is getting enough blood and nutrients to it. Good. Very good. Okay. So I'm going to start by finding gallbladder 13, which is, if you take the middle point right here, which is GV24, I believe, and stomach 8, which is the intersection of these two lines right here. And then you're going to go lateral 1/3, 0.5 so into the scalp. This is where you find gallbladder 13, so we'll find it on the other side as well. Right there. You'll find a little depression. Great for frontal headaches, but also neck pain and rigidity. Just pressing using these little circles. Releasing tension in the scalp. Just releasing all of it. I'm just going to go the other direction. Very good. Okay. Now the actual gallbladder meridian, interestingly, is halfway between stomach 8 and GV24. So if that's stomach 8, that's GV24, would be around here. So I'm just going to make a part following the curve of your head. Make sure I really follow that curve because sometimes it can be difficult to do that. Okay, so So I'm going to do the same thing on the other side. Again, stomach 8, GB 24, go halfway, and make a line following the curve. I don't want to lose the other one either, so just... Actually, I think I created another hairstyle. This is your hairstyle for the next little while. Just like that. Okay. And just doing that. So now that we roughly have the gallbladder meridians mapped out, or rather the parts done, we're going to start at, so we did 13, so we're going to do 14. So I'm going to start by finding gallbladder 19, which is, you find the little apices of the ears and you go all the way to the top and on either side. That's where you find gallbladder 19. Just going to massage that. So these two are such excellent points, also, especially for vertex headaches and headaches in general. Also for dizziness, vertigo, this can be really helpful. Lightheadedness, similar to governing vessel 20. Very good. And we have two other points here. So that was 19. We have 18 and 17 situated right here. You'll find two little depressions. And let me start by 18. There you go. Perfect little depression. Again, similar properties. Helps with headache, neck rigidity, vertigo, dizziness. Good. And then gallbladder 17 is right over here. Just using two fingers and very good. Let's take a little break. How are you feeling? Good. Great. And there's one final point in the gallbladder meridian, which is actually, take that off. It's pretty easy to find. Again, it's in those same lines that we found earlier. And goes straight superior from gallbladder 21. This is gallbladder 20. And you're going to find the external occipital protuberance right there. You're going to go right above it and then lateral to it on either side, following the traps right up, and you'll find it right there. Perfect. I find that sometimes I have this habit of, tensing myself when I'm giving someone else a massage, so it's really important to practice deep breathing and relax yourself as well. Good. Okay. And the final 2 points that I want to do acupressure on, Taiyang, which is if you find the outer canthus of the eye and then the end of the eyebrow and go right in between, that's where you'll find it. And just slightly posterior. It's a nice depression, a great place for acupuncture as well. Great for headaches of the temple, unilateral headaches. But also for expelling wind, clearing heat. Good. Just switch to my thumbs. How does that feel? Does it feel kind of achy? Good. It means it's working. The great thing is the temporalis muscle is also here, so for someone like you that clenches your teeth a lot, this is especially beneficial. Very good. Okay, and the final point to end everything off, a great calming point. You find the 2 eyebrows, go right in the middle, yin tang. Massaging right in. Great for frontal headaches, great for calming the mind. Just overall, like one of my favorite points ever. Also where the third eye lies. Final little scalp massage, just to end things off, and gentler this time. More reflex stroking, which is my favorite way to end a massage. Stimulating that parasympathetic nervous system. And that's the end of the massage. How are you feeling?
Much better, thank you.
Glad to hear that. You're so welcome. And I hope you have a good night's sleep.